Hope actually came knocking on my doorstep. My pulmonologist, she said, I think that you should talk to them because they do double lung transplants on cancer patients. And I was like, what?
When we spoke to Natalie in 2024, she was hoping for that transplant after a shocking diagnosis, stage 4 lung cancer at just 33 years old. Her hope became reality. When we caught up with Natalie, she told us that the path had more complications and twists than she ever expected.
Before I had the double lung transplant, wasn't even sure I was gonna make it 5 years. This was like a life changing surgery. It was risky. Like, hey, when I wake up, I will no longer have lung cancer. That's what I was thinking. So in the past 12 to 15 months, I've been having to focus on rebuilding myself, not only from a physical standpoint, but I would say a mental standpoint as well. Well, I'm not one of those people where people get to, I guess, the end of their life and they're like 80 or however old they are, and they say, well, I've done everything. I'm okay with passing away and so forth. Well, I'm not. I'm not quite 40 yet, and there's still a lot of things that I want to do. I want to, other than travel, I want to hang around. I want to be around my family. I want to be around my friends, but I want to try to make an impact in people's lives. I want to continue to share my story to try to give people hope. I think that'll make life worth living. My cancer has started to progress. I had gone through 2 clinical trials already. They unfortunately failed. I tried 2 different chemotherapies after I started to progress, and they failed also. So the idea behind this was to, hey, well, let's keep trying different chemos or different clinical trials and see if the progression stops. So that's when one of my healthcare providers, she actually knew about this double lung transplant program. And then my health started to decline. So I think my left lung had dropped down to like 3% functionality. It was only acting as if I had 1. So my day-to-day started to get harder. I never was on oxygen or anything like that, but when it started to get difficult for me to do things, I said, okay, I think we do need to go ahead and fully entertain this. So my initial reaction was I was afraid, and I didn't know what a double lung transplant was. It just sounds really scary, like a double lung transplant. And I just like, am I even going to be able to make this work? I had been, of course, I was on ChatGPT and I was reading all this stuff, and it's like the survival rates of transplant patients, and it was just saying all these things, and I'm just like, oh my goodness. However, I thought about it. When I did have a consult with the surgeon at the hospital, he said your lungs are trash. So I was very afraid, but once I actually knew how bad, once I heard him say your lungs are trash, which I already knew that, I said, okay, let's move forward with this testing. So my hope is based off of what I was told. So first of all, the surgery is considered a clinical trial. So they let you know up front that, hey, there is a possibility that this may work, may not work. Obviously, we're doing this for the greater good of it working. I'm going to get my lungs removed, these diseased lungs removed, and I'm going to get them replaced with some brand new lungs. So that was my thought process. Like, hey, when I wake up, I will no longer have lung cancer. That's what I was thinking.
Natalie would have to move from Atlanta to Chicago to move forward with the double lung transplant.
I was thinking about costs, number one, because all the financials are on you. It's not, you don't get any help or anything for relocating. So that was something that I thought about. I thought about having people up there with me. How often would someone be able to be there? Would I be okay mentally? How long was it going to take me to recover? It was just so many things. Am I even going to before we even got to that point, am I even going to meet the testing qualifications? Because you still have to go through about, maybe I would say 2 to 3 weeks of testing. I would say maybe a little longer. So I'm thinking I still have to get past that. Then once you do that, it's like the board has to meet to still decide whether or not you're qualified, even though the results may say one thing. It was just so many things, because this was like a life-changing surgery. It was risky. So once you actually get there, then that's when they say, oh, we have officially put you on the list. It could take anywhere. I think I was told you could get a call as quick as 24 hours, which is unlikely, but it has happened, or you could be waiting as long as 60 days. They called me on a Thursday night at like 8 o'clock p.m. and they said, hey, we might have a pair of lungs for you, but we don't know yet. So what you'll have to do is come into the hospital on Friday morning. We'll have to do testing for you and see if you basically your lungs are going to be a fit. It's going to be between you and somebody else. I was at the hospital for like 5 hours before I even found out that I was the official person for the lungs. So they called me and they came in my room and said, hey, just to let you know, the lungs go to you. I'm so afraid. So they instantly gave me something to calm me down because I was about to jump out of the bed at that point. And they ruled me in. We, talked. I talked to the anesthesiologist. They gave me the calming medicine. They rolled me into the room with like 50 other people. And I was just like, oh my goodness. And next thing I know, I wake up, it's another day. I heard a lot of people go through this mental situation where it bothers them that they don't have their original lungs and, they have a deceased donor and all that. God bless the donors. I haven't really had that issue that much. I'm extremely grateful for being able to get the lungs. Definitely sorry about how I had to go about getting them, but it hasn't bothered me, I don't think, that much, because I think I try to focus on just making sure that the lungs are healthy, because these lungs can still go into rejection. That's a whole nother part of it. You have to take these rejection meds your entire life. So instead of me thinking about the situation, I try to think about the situation like, hey, let's try to make sure we keep these lungs healthy. Let's try to work out. Let's try not to be around certain things that will possibly cause rejection or make things worse. So I try to focus on the quality of life of the lungs. Probably about a month after I did surgery, my back started to hurt. And I kept telling them about it, and they would say, oh, well, it's because you're doing therapy and you're stretching your muscles and you haven't really moved. And I was just like, no, something just does not seem right. So I was already due for scans anyway, just because still dealing with my history. I'm going to have to get scans for life anyway. We're probably about 2 months after surgery now. And then I go ahead and have a scan. And they called me like so quick. And but I already knew something was wrong because they called too quick. And when they called, they asked me how soon could I come in. And I said, the first thing I said, the cancer is back, isn't it? And they're like, well, we really want you to talk to the doctor. And then my phone went off for my chart notification. And I was like, should I open this or should I not? So I'm already about to hyperventilate because at this point, like, I'm by myself right now. And I opened it, just scanning it. I didn't even want to like read it in detail, but I saw enough words to say, okay. So I like called my husband. I'm like screaming. I'm like, the cancer is back. I don't really even know anything, but I'm just like, the cancer is back. And, why did I have this surgery? I'm just, he's trying to calm me down. Obviously, he's not there. We went to the doctor. Of course, they were like a bunch of things lit up and this. But what we're mostly concerned about at that point was, your spine, your back area. So we needed to do a biopsy of the spine, and fast forwarding, we did, and it did come back and say that I have cancer in my spine. I have, I think, 4 or 5 lesions, which is why my back was hurting to the length that it was hurting. So I was angry because at this point I'm like, why did I even get this surgery done for the cancer to come back? And I'm asking them like, hey, please tell me why it can't, like, just give me something. And nobody really could give me an answer. We were kind of thinking that maybe this might have already been there, and it was hiding, and then something just made it come up to the surface, because I have been complaining about back pain for years, and we have been checking for years and nothing ever came up. So nobody to this day really knows where and how, but in the back of our mind, I've just had this major surgery to get rid of cancer, and boop, now here we are again dealing with it. I had to start chemo and radiation. Today is a chemo day, and I have Mom with me. Say hey, Mom. Hi. So I had another rough patch during all of this. Unfortunately, at the beginning of the year, my grandmother and my father-in-law actually passed away on the same day. So while I'm dealing with all this, I lost them too. And my grandmother, like, if anybody knows me, hands down, best friend, best person. So that actually set me back mentally. But a lot of the times that I was going through things, I was always thinking about my grandmother. Like, my grandmother would always tell me, I basically feel like I got the ability to be strong from her. Anytime any situation came up, I'm always hearing her in my brain, like, hey, I know you just overcome, you just have another obstacle, but like, hey, let's do this. Like literally, I feel like my grandmother was just always talking to me. And so I always talk about my husband as well being a good influence also. So I would think about him and then I would think about my grandma. And I'm like, okay, all right, grandma, I got this. I can do this. That's the only way I think that I would have made it through. I just have so much more energy now. It's the strangest thing. I mean, of course, if I work out, I'm going to be tired, but I know this is going to sound crazy when I say this, but life is actually pretty darn good. I would say that for me. From where I came from to now, there's so many things that have changed. I'm so much more happier. I'm just so glad that I can do these things and like share my story. It has I've gotten more into advocacy. So I am here at the Lori Cancer Center. I am going to be a speaker today at the Lung Cancer Town Hall Awareness. Super excited for this opportunity. I want to show people what a stage 4 cancer patient and advocate can look like. Everyone does not look like me. Everyone doesn't function like me. Everyone is different depending on treatment, stages, and all of that. But I want people to know that stage 4 is not always a death sentence. Are you going to have struggles and issues? Of course, who isn't? It's stage 4 cancer. But I want people to know, and then I also want people to know, I'm sure you've heard this phrase 1,000 times, but I'm going to repeat it 1,000 more, that as long as you do have lungs, you still can get lung cancer. So before I had the double lung transplant, I didn't think much of the future, just being completely transparent. I wasn't even sure I was going to make it 5 years. So the fact that I'm at 5.5 just really means a lot to me. But now I do look at the future differently. I'm not as scared or as fearful as I was before, because I feel like this surgery has opened up more healthy opportunities. Miracles do happen. At one point I wanted to give up, so I'm not going to even act like I just have had it together all this along, because I haven't. I wanted to give up. But I would encourage people to be close as possible, like with your medical team. I think that helps a lot. The better the relationship, the closer you are with them. I just try to encourage people to don't give up. And then also, I would try to encourage people, if you feel comfortable, share your story.
As a cancer survivor myself, Natalie, thank you so much for sharing your story with us. If you're interested in Natalie's first symptoms and her path to diagnosis, we've queued up her first story here. And please make sure you subscribe here to the Patient Story community, where we continue to humanize cancer one story at a time and remind people you're never alone.